Thank you, Chairwoman DeGette, for holding this critical hearing, and thank you to our witnesses for joining our committee while we seek answers from the public about this public health emergency. And I think you're hearing in a bipartisan way, the research is really important, communication and transparency of the data to the American people. I can certainly say as a parent, this is a very scary time in terms of I personally don't think we should be holding out any of these products as quote unquote safe to the public because we haven't had the research and we have not thoroughly tested them. Based on the data, just as we were on the precipice of minimizing tobacco's hold on our nation's youth, the tobacco industry has devised a new way to place our children once again in the crosshairs. As a result, e-cigarettes are now the most commonly used tobacco product among youth, surpassing the rate of youth use of conventional cigarettes 5 years ago in 2014. In fact, e-cigarette use among youth doubled from 2017 to 2019, doubled, demonstrating this problem is only getting significantly worse. In my own home state of New Hampshire, the Department of Health and Human Services estimates that at least 1/4 of all high school students use vaping products, and that number is on the rise. Now, you may know that our state is still in the throes of an opioid epidemic that began with misleading marketing and lack of regulatory oversight. My fear is that we're repeating those same mistakes and making way for a new generation grappling with addiction. And that's why I'm proud to co-sponsor the Reversing Youth Tobacco Epidemic Act of 2019, which includes numerous important provisions to curb the rise of youth tobacco use. And with that, I want to ask a few questions. Dr. Schuchat, based on CDC's surveillance and research, what do you believe are the reasons that young people are smoking e-cigarettes at such alarming rates?
We know that flavors are a principal attractant to young people. The latest generation of e-cigarettes also are extremely high in nicotine content. They often include nicotine salts, which are a little bit more palatable or less bitter, and the flavors are, really targeted at youth. So we think the addictiveness of the high nicotine level and the appeal of the flavors are key. We also think some of the companies have had youth targeting ads.
And the marketing. According to the National Institute of Health, 81% of adolescents who have ever used tobacco products began with a flavored product. Dr. Schuchat, what more can you tell us about the contribution of flavors to this dramatic rise? And you've mentioned this. Anything more to add?
Yes, I think that we have seen a little bit of a shift in the most recent preliminary data with an increase in the menthol and mint flavors among what youth are using. So we do think flavors are a critical beginning to youth use, and then the nicotine provides that addictive substance that keeps them going back.
Thank you. And Dr. Sharpless, will you ensure that the newly announced federal policy to clear the shelves of flavored e-cigarette products will be effective?
We believe this policy will have a dramatic effect on the flavored products sold in the market today.
And does that include menthol and mint cigarettes will be cleared from the shelves?
We are finalizing the policy, and I don't want to prejudge the policy under preparation, but I can say that the data support mint and menthol being a significant problem, as Dr. Schuchat alluded, that it's been very popular with children.
Thank you. Last year, as part of the FDA's comprehensive plan for tobacco and nicotine regulation, the agency launched the Youth Tobacco Prevention Plan. Dr. Sharpless, what are the goals of this youth-focused plan, and can you discuss the status of some of the efforts like the Real Cost campaign that FDA has or plans to implement?
Thank you for the question. The FDA is a long-standing anti-tobacco campaign, educational campaign. Initially, it was focused around combustible cigarettes, getting youth not to use that. We believe it was very successful in that regard. The campaign reaches 11 million kids aged 12 to 17 who are users of tobacco products or open to using tobacco products. In the last year or so, we have really shifted that focus to e-cigarettes to catch up with this epidemic. This includes some new TV ads that are very they really tested off the charts with the youth markets. They are strong ads to discourage youth use of e-cigarettes. to make sure kids are aware. You know, sometimes kids aren't even aware that some of these products contain nicotine, for example. So juuling has become a verb in high schools that is not really understood to be a dangerous product necessarily. So there's really a lot of education effort devoted by the FDA towards this topic.
Well, in my view, manufacturers and retailers are creating a new generation of nicotine-addicted consumers at a time when our nation's youth face unique obstacles now more than ever. So it's important we take action to constrain further reversals and protect our youth. And with that, I yield back.